Welcome back. We're going to start out with Chapter 8, Lifespan Development. The topics we're going to discuss are going to be infancy, which is birth to 1 year of age, toddler phase, which is 12 to 36 months, preschool age is 3 to 5 years old, school age 6 to 12 years old, adolescent 13 to 18 years old, early adult 19 to 40 years old, middle-aged adulthood 41 to 60 years old, and late adulthood, 61 years and older. Let's start out with the infancy, birth to 1 year of age. Here is what is considered a newborn infant. From a physiologic standpoint, they are normally 6.6 to 7.7 pounds at birth. The weight doubles by 6 months and triples by 12 months old. The head is 25% of the total body weight. The airway is narrow, short, and easily obstructed. The nose and diaphragm are used for breathing. Antibodies are passed from the mother to the child during pregnancy, and antibodies are also passed through breastfeeding. So the Moro reflex, or the startle, is when they throw their arms out, spread their fingers, and then grabs with the fingers and arms. The palmar flex is to grasp the object placed in their palm. The rooting reflex, or hunger, is when they turn their head to the side when their cheek is touched. And then the sucking reflex, which is sucks when the lips are stroked. So their sleep pattern, they sleep a lot. They initially sleep about 16 hours a day, so 8 hours throughout the daytime and the nighttime each. Soon it changes to 4 to 6 hours during the day and 9 to 10 hours at night. And by 2 to 4 months, they will hopefully sleep through the night. So their extremities grow in length from a combination of growth plates at both ends of the long bones. The fontanelles are not fused at birth. So the posterior fontanelle closes in 2 to 3 months, and the anterior fontanelles close in 9 to 18 months. If they do have what's called a sunken fontanelle, indicating dehydration, so this is very serious. If they have bulging fontanelles without crying, it indicates an increased pressure inside of the skull, and again, a very serious condition. With the bonding, that is the sense that the needs will be met. The trust versus mistrust, so they desire for an orderly and predictable environment. Scaffolding is when they're learning by building on what is already known, and temperament is the reaction to the environment they are around. In this next phase, we're going to talk about the toddlers, which are the 12 to 36-month-olds. So here is a typical toddler getting into stuff they're not supposed to. So from the physiologic standpoint, the body temperature ranges from 98.6 degrees to 99.6 degrees Fahrenheit. Their weight gain will be about 4.4 pounds per year, and their body systems will improve with efficiency. The pulmonary systems will have terminal airway branch and growth, and the alveoli will increase in numbers. The nervous system, the brain is 90% of an adult brain weight, and fine motor skills then develop. In the musculoskeletal system, the muscle mass and the bone density increase. With the immune system, they are more susceptible to illness, and the immunity develops through exposure and vaccinations. With their teeth, all primary teeth come in by 36 months, and the toilet training is physically possible between 12 and 15 months of age, but not psychologically possible until 18 to 30 months. So if you got one of those lucky kids, or if you're a lucky parent, I should say, that they potty train at 12 to 15 months, congratulations, you will save on diapers. So with the psychosocial side of things, they begin to understand that words actually have meanings. They begin to understand the cause and effects. They develop separation anxiety. They begin to develop magic thinking and engages in play acting, and masters language basics that are refined through childhood. In the next section here, we're going to talk about preschool age, which are the 3 to 5 year olds. Here is a preschooler. With the physiologic, the body systems continue to develop, and with the psychosocial, that is when interactive and social skills develop. Peer groups provide information about other families and the outside world, and peer interaction offers opportunity for learning, making comparisons, and then being a part of a group. In this section, we're going to discuss the school age of 6 to 12 years of age. Again, school-age children. The physiologic side of the school-age kids 6 to 12 years of age, the body temperature ranges from 98.6 to 101.3 degrees Fahrenheit. The weight gain will be about 6.6 pounds per year. Their growth will be about 2.4 inches per year, and their primary teeth will be shed and replaced with their permanent teeth. From a psychosocial standpoint, parents spend less time with the child and provide general supervision. The decision-making skills then develop. Self-esteem develops and is affected by popularity, rejection, emotional support, and neglect. And the moral development begins based on rewards and punishments for their behaviors, and moral reasoning appears and control of behavior shift to internal sources. In this next section, we're going to talk about the adolescents of 13 to 18 years of age. Again, the adolescent is the age of 13 to 18. From a physiologic standpoint, a rapid 2 to 3 year growth spurt begins with the growth of the feet and the hands, and then the arms and the legs. Sexual maturity is reached and secondary sexual development then occurs. With the psychosocial, they strive for independence and individuality and their identity. They get interest in sex develops. Their body image becomes a concern. They may be prone to self-destructive behaviors, and personal code of ethics then starts to develop. Early adulthood is going to be this next section from 19 to 40 years of age. Again, early adult, 19 to 40 years of age. In the physiologic, they have lifelong habits that are formed. They're at their peak physical condition, which occurs between 19 and 26 years of age. From the psychosocial standpoint, job and family stress levels are beginning to be high. Marriage, childbirth, and child rearing often occur. And accidents are the leading cause of death in this age group. In this next section, we're going to talk about middle adulthood, which is 41 to 60 years of age. Here are your middle-aged adults. Physiologically, there are no significant changes that occur in vital signs. The vision correction may be needed at this point. They might have cancer, high cholesterol, and heart diseases, which then often develop during these years. Weight control becomes more difficult, and menopause may begin for women. With the psychosocial, the task orientation increases. Problems are viewed as challenges rather than threats. An empty nest syndrome may start to occur. Is concerned about both adult children, however, they also have the adult elderly parents. In the next section, we're going to talk about late adulthood, which is 61 years of age and older. Here you have your older adult, or what they call the seasoned group. Physiologically, their vital signs depend on their health and physical condition. Cardiovascular system is less efficient and blood volumes are decreased. Their respiratory system deteriorates and increases the likelihood of a respiratory disorder. Their endocrine changes, which decrease the metabolism. Sleep-wake cycle is disrupted, and other body systems deteriorate as time goes on. The psychosocial may face many challenges with living environments, self-worth, financial burdens, death, and dying. So motivation, personal interests, and activity levels can enhance late adulthood. Now to the chapter review. Understanding the basic physiologic and psychosocial development for each age group will assist you in communicating and assessing patients of various ages. Physiologic differences between the ages will also affect your care. Examples include differences in the respiratory system of younger patients and the effect of pre-existing medical conditions of older patients. Infants and young children have less developed and smaller respiratory structures, which can make respiratory conditions worse. Your ability to communicate with younger patients will depend on their stage of development. This can range from fear of strangers to separation anxiety from parents and embarrassment during adolescence. Older patients may have issues with denial or depression over medical conditions. Remember that infants undergo big bursts of anatomical and psychosocial development in their first year of life. Although preschoolers begin to develop independence and reason, in many ways their psychosocial development is similar to that of other toddlers. Remember that school-age children often are independent and logical, but they may regress to an earlier stage with illness or injury. Adolescents are reaching physiologic maturity, but they often face difficult psychosocial challenges. Remember that early, middle, and late adults vary greatly in terms of psychological development and conditioning. They also face psychosocial challenges unique to adulthood. Questions to consider. How do I approach a patient most effectively based on the developmental characteristics? Does the age of my patient pose any assessment or care challenges based on the physiologic development? Critical thinking. You are called for abdominal pain in a 16-year-old girl. She is with friends at the park. She seems hesitant to answer any of your questions. What characteristics of adolescent development is most likely the cause of this? How could you overcome it?